Research has shown that hypertension is most effectively treated when the patient is a part of a larger care team. Who these team members are and the important roles they play in managing a patient's high blood pressure may come as a surprise.
And mostly when I shoot the basketball, my son and I play every day.
Specialty care providers use their expertise to resolve specific health problems every day. This important work can sometimes overshadow the invaluable role you play in addressing chronic diseases your patients have, including hypertension.
Well, although you came in for a shoulder injury, when we checked your blood pressure earlier, it was kind of high. So I recommend you follow up with your primary care provider next week. In fact, I'm going to send her a note right now.
Many patients see a specialist more often than their primary care provider. This opportunity to intervene in hypertension management by taking accurate blood pressure measurements every visit and referring back to the PCP can mean the difference between a healthy life and a debilitating stroke or heart attack down the line.
Good morning. Nice to see you again, Mr. Smith.
Thanks, just checking in for my 10 a.m. appointment.
Great. I see you were referred by your orthopedist for your blood pressure. I'm sure Dr. Roberts will be glad you came in for this.
Many aspects of a patient's visit, including blood pressure measurement, can be impacted by the welcome he or she receives.
Dr. Roberts is running on time. Have a seat and we'll bring you back shortly.
You're on the front lines in the fight against high blood pressure. Your calm and efficient welcome sets the stage for an accurate blood pressure reading, which can have a tremendous impact on a patient's life.
Hi, Mr. Smith. You can come on back with me. Hi, Mr. Smith. My name is Danielle, and I'll be taking your blood pressure.
Hi, Danielle. Thanks.
It's important that the patient waits 5 minutes to ensure a more accurate resting blood pressure. It also gives you, as the medical assistant, time to complete documentation and ask questions of the patient.
Thank you, Mr. Smith. So that's 154/92, and I'll be sure to enter that into your record today.
Okay.
As a medical assistant, you may have taken several hundred or even thousands of blood pressure readings. By following the proper steps, your readings are the first step in crucial treatment decisions that impact thousands of patients.
Well, your blood pressure readings are still high today and consistent with what your orthopedist shared. But let's talk about what this means and how we can help you bring your blood pressure under control, okay?
As the trusted primary care provider, the urgency and importance with which you treat hypertension will resonate with patients. That's why it's crucial to immediately address the disease, discuss and mutually decide upon treatment options with the patient, and schedule a follow-up appointment within 30 days.
Thank you. You've answered all of my questions. I'll share this with my wife, and if we have additional questions, we'll call. And I'll get the new prescription and work on eating better.
That's a great plan. Now, you know you can call on me if you have any questions or concerns. Are you still at that pharmacy on Maple Street?
Yes.
So I can send the prescriptions there for pickup?
Yep.
Okay.
Your role as a nurse manager is crucial to blood pressure measurement and control. You set the tone in the office and ensure that blood pressure equipment is working properly, staff are trained in accurate technique, and the entire care team is supporting your providers.
Now we're going to talk about blood pressure. The entire team passed last week's measurement checks with flying colors. Good job, team.
Your efforts to track and communicate team goals has a tremendous impact on the most important bottom line, patients' lives. High-quality care for patients with hypertension is virtually impossible without effectively utilizing your information systems. And you, the IT and data specialists, ensure these systems run smoothly, are updated regularly, and serve as essential resources for the entire care team to flag and treat patients.
The numbers are improving. Looks like the new EHR alert and visit summaries are working.
Your behind-the-scenes work, creating hypertension registries, EHR updates and alerts, and quality reports, helps the care team manage hypertension in the patient population and avoid long-term complications.
Mr. Smith, how's the family?
Family's good, thanks.
I've got your prescription from Dr. Roberts all ready to go.
Great. Yeah, my blood pressure's been a little high lately, so I'm hoping the medication will help.
Patients visit their pharmacies more frequently than any other health setting. We know your role in hypertension control is much more than just filling prescriptions. You educate patients, improve adherence, reduce adverse effects, and collaborate with other care team members.
Now, since this is a new prescription, I've gone ahead and made sure that it won't interact with any of your other medications. Now tell me, how did Dr. Roberts tell you to take this medication?
Medications are a key component of blood pressure control. Your interaction with Mr. Smith and his care team will help him achieve his blood pressure goals.
So, Michael Jordan, how did your appointment with Dr. Roberts go?
Well, I'm glad you encouraged me to go get my shoulder looked at. Turns out my shoulder will be fine, but I have high blood pressure. Now, Dr. Roberts said that my blood pressure will be under control soon with medication she gave me and some changes I'll have to make.
Arguably, the most important member of the care team is the patient. He or she is the one living with high blood pressure every day and making the changes necessary to control the condition. By including patients in decisions about their own health and providing the resources needed to put these decisions into action, patients with high blood pressure will truly be positioned to live long, healthy lives.
Starting with this.
High blood pressure is a serious disease, but with the support of a dedicated care team, patients have a greater chance of living long and healthy lives.